Good morning and welcome to the Work Support Strategies Forum, the Lessons on Program Integration. My name is Helen Neuborne and I'm the Director of Quality Employment at the Ford Foundation. And the Ford's goal on this work is really to help more low-wage working families move toward economic stability. And so one of our key projects on this is the Work Support Strategies Initiative, which is a partnership of 6 states and some of Washington's leading organizations, like the Center for Law and Social Policy, the Urban Institute, and the Center for Budget and Policy Priorities. The goal of this initiative, which is in its 4th year, has been to improve the way states deliver a range of health and human services to millions of customers and their families. At a time when more and more people had been saying, government really isn't working, instead of fixing it, we should shrink it. Some people wondered why the Ford Foundation would want to get into the middle of that, roll up its sleeves, and create a partnership with states to help them improve service delivery. So at the time, state leaders willingly admitted to us that many of their systems and structures were breaking down. Indeed, they described them as dysfunctional. But in what was surprising to even us, nearly more than half the states in the country actually applied, describing their critical need for updated technology, streamlined bureaucracies, and new operating processes that would help them strengthen both the customer experience and reduce the burdens on the workers. So solving such a challenge really goes to the heart of what it is those of us in the philanthropic community do all the time. We're tackling major problems at a scale that we hope will result in real and enduring change. And in this case, creating opportunity for low-income populations and keeping more low-wage working families actually on the job. Federal and state governments remain the largest source of resources that are targeted at these issues that drive our work. And clearly, our funding doesn't come close to that. But as the progress of this initiative so far demonstrates, when a project has clear goals and strong leadership, you really can successfully partner with state and public agencies. And we're not doing it alone. We're delighted that the Annie Casey, the OSF, Open Society, Kresge, and more recently, JP Morgan Chase Foundation have all joined to work on this effort with us. So today you're going to hear from 5 of those 6 states and learn how high-quality technical assistance and peer learning help them make changes which are already serving as models for other states. You know, the Ford Foundation mission states that we're supporting the organizations and people who are on the front lines of social change. Well, in our Work Support Strategies initiative, we're doing exactly that. We're partnering with state government and state agency leaders who, as change agents, are making life better for thousands of their own staff and thousands, if not millions, of customers and their families, most of whom are working very hard trying to keep their heads above water in a very challenging economic environment. So we thank them for that, and we thank you for joining us today to learn more about this exciting work. Now I'd like to turn it over to Olivia Golden, who is the Executive Director of CLASP and the Director of the Work Support Strategies Project. Thank you.
Thank you very much, Helen. Is the microphone working? Can you hear me? Terrific. So good morning to everybody. I'm thrilled to be here with an amazing group of panelists for today's panel on lessons from program integration. More than 100 people, as you can see, looks to me like almost 150 are in the room. And on the web, we had more than 500 people sign up. So welcome to everybody. I'm hoping, or I think you should expect, a very lively and honest conversation about what it takes to achieve substantial change in state government programs, about what program integration really means. It's a nice abstract word. What does it actually translate to? And about what it takes in the context of health reform, the Affordable Care Act, political challenges around all of these programs to actually bring programs together in an effective way. As Helen mentioned, the panel of state leaders who've joined me here represent 5 states that have been working together with support from 4 foundations and a team of national experts on the Work Support Strategies Initiative. The goal of that initiative is to help low-income working families stabilize their lives, move up at work, be healthy themselves, and raise healthy children by making sure they get and keep the full package of work support benefits that they're eligible for. And in particular, it's about health insurance through Medicaid and the Children's Health Insurance Program, nutritional assistance through the Supplemental Nutritional Assistance Program, or SNAP, which used to be called food stamps, and help paying for child care through the Child Care and Development Block Grant. The states in the project are very diverse, politically, geographically, urban and rural. Here today, and I'm going to introduce them in a moment, are leaders from Colorado, Illinois, North Carolina, Rhode Island, and South Carolina. Idaho is the 6th state in the project, but they couldn't be here for the conference because they're centrally involved in putting together their state exchange back at home. So in just a moment, I'll say a little more about work support strategies and the specific topics and format of today's discussion. But first, I want to introduce the 5 state leaders and the extraordinary national commenter, respondent that we have on the panel. On this end of the table, we have Reggie Bicha, who was appointed Executive Director of the Colorado Department of Human Services by Governor John Hickenlooper in 2011. He's also President of the American Public Human Services Association Governing Board. That's all of the cabinet secretaries from all over the country. And he was previously the inaugural secretary of Wisconsin's Department of Children and Families. So he brings a very broad perspective. Next to him, Sherry Bradsher, the Deputy Secretary for Human Services in the North Carolina Department of Health and Human Services. Her 28 years of state service began in 1986 when she was a Child Protective Services social worker, and she's held almost all the jobs in between over the years since. Deborah Buffi is the Associate Director of Management Services in the Rhode Island Department of Human Services. She served there for almost 20 years. She oversees field operations for the whole array of human services programs and Medicaid, and she's also leading the department's planning and rollout of the Affordable Care Act technology and integrated eligibility system, working closely with the Health Lead Agency. To my right, Karama Bailey is Acting Deputy State Director for Economic Services at the South Carolina Department of Social Services. She has very broad experience in all aspects of program operations and management and began her early career also as a social worker. And next to her is Jennifer Wagner, the Associate Director of the Division of Family and Community Services with the Illinois Department of Human Services. She too is responsible for the eligibility and operations of SNAP, of welfare, and of the administration of medical assistance, including policy, training, and management of local offices throughout the state. And next to her, our extraordinary panelist, Robert Reischauer, is former director of the Congressional Budget Office, President Emeritus at the Urban Institute, my former boss. He writes and lectures on a wide range of topics: health, federal budget policy, social welfare, is one of 2 public trustees of the Social Security and Medicare trust funds, and a little-known fact is that early in his career, before he became an expert on all things federal, he was also an expert on federalism and the federal-state relationship, so he's a perfect commenter for this session. Our format for today's conversation, I'm going to make just a couple making a special effort. Which highlights the before picture. It shows that when you look state by state at how many people are eligible for both health coverage under Medicaid and help with food assistance, you get quite a large number of children in particular, but only about 2/3 of them are actually getting both of those things. So that reinforces the idea that there's a big opportunity for families here. It doesn't require new laws or new state budgets. It also highlights the second goal of this project, which is there's an opportunity to reduce burden on state workers. Because if somebody's already getting one of these benefits, then there's paperwork, there's computer records. Why is it that somebody ought to have to bring it all in again, have a worker process it again, when you actually might be able to do it more simply? So you're going to hear a lot about that as a key theme. The last thing I want to say is a quick ground rule, which is that we have an amazing range of people in the audience, in person and on the web. We have experts in human services, in health, in early childhood. We have federal officials, state officials, advocates, people who work for nonprofit organizations, members of the press, people who work with unions, people who have a broad public interest as citizens themselves. So that means that none of us can slip into the jargon of our day-to-day work. And so I'm going to try to hold the panel to as few abbreviations as possible and also hold people to it in the question period. It's complicated enough to think about how an idea that comes in legislation or in policy actually translates or doesn't translate to change people's lives. We're going to try to explain that without jargon. So with that, I'm going to go on to what I think will be a very exciting conversation. And I'm going to start with Reggie Bicha. Welcome, and thank you for joining us. I guess I wanted to start by asking, you and your team in Colorado, you've been part of Work Support Strategies since 2011 when you joined the state. Can you tell us a little bit about why you got involved, what your vision is, and kind of where you are on it? What have you gotten done so far,
Sure.
3 years in?
Good morning, everyone. So let me describe the state of affairs in Colorado back in January of 2011 when Governor Hickenlooper took office. Medicaid, which is run by our sister agency, Healthcare Policy and Finance, as well as the food assistance program, we call it SNAP, Food Assistance in Colorado. We're both under court orders because we were not processing eligibility determinations fast enough. That's always a good way to get one motivated to make changes in your state. We have this integrated system in Colorado that we call CBMS. It's the Colorado Benefit Management System. Now, it's actually a strength because it truly is one integrated system that determines eligibility for a variety of programs, including all Medicaid, food assistance again, Colorado Works, which is our TANF work program, and so forth. The challenge with it is that CBMS rolled out in 2004. It was underfunded at the time that it rolled out. It never worked right from the very beginning. It was headlines on the Denver Post about how horrible CBMS was, how long it took for folks who had applied for benefits to get benefits. And if you talk to any of our county partners, they would tell you it was probably the worst invention that has ever been made. And to further smooth things out around CBMS, it was managed by 3 agencies: CDHS, my agency, Healthcare Policy and Finance and Medicaid agency, and then we had another agency called the Governor's Office of Information Technology that managed all IT systems. So if you wanted to see a system that was dysfunctional, didn't work, and you wanted to see who was accountable, all you had to do was go like this, right? And everybody was right by doing that. We had this thing called the Affordable Care Act. You may have heard about it. That was looming over us. We had quite decisions to make, about whether or not we were going to expand Medicaid, which we ultimately did. But we had to build a healthcare exchange. We had to fix CBMS and make certain that it worked for the new requirements of the Affordable Care Act. And we had to do it right now. And then we have a state-supervised, county-administered system in Colorado, which I think is the strongest type of system because it brings the benefits of local communities where children and families live and prosper, along with state infrastructure and support. The challenge with that is we have 64 counties in Colorado who do the day-to-day responsibility of determining eligibility. And in 2011, there was tremendous tension between the state and counties. This system didn't work, and if you wanted to know who was responsible, if you were the county, you just pointed at the state, and if you were the state, you just pointed back at the county. Everybody was correct. We could go on and on with the challenges, but what the Work Support Strategies Initiative did for us in Colorado, along with new leadership and a fresh perspective, and most importantly, a commitment to worrying less about us and worrying more about the recipients that we all mutually serve, was to bring us together, provide some resources and technical assistance that help us cut above the fray, and come up with some real strategies that have turned our system around, Olivia.
Do you want to give us one example? I know we're going to have much more time in the Q&As to talk about others, but one thing that's different that you're especially proud of?
Well, let's talk about CBMS. What we set out to do was to rebuild CBMS. Those three agencies, along with county leaders, got ourselves in a room and we're just honest with one another about what didn't work well and what did work well, and made a commitment to work together, open, honestly. We had something that I think is highly unusual from when I talk to my colleagues across the country. We brought county officials and they sat at the table with equal votes as cabinet members across the agency. And together we put in place a plan to rebuild the Colorado benefit management system so that it was relevant, functional for a 21st century delivery system. We couldn't have done that without the Work Support Strategies team being there, helping us understand the challenges and opportunities that we had before us and helping us create a path to get that system rebuilt. What that means today to workers in our state, if you go back to 2011, literally you could put in information in CBMS and hit the enter key, and workers would get up and go get a cup of coffee because the system was grinding doing the eligibility determination. Today, we in Medicaid have, through all of the system changes, 80% plus real-time eligibility for determining Medicaid in our state. So it's a tremendous shift from where we were just a few years ago.
So just one last question for now. Colorado's a state, really all of the work support strategy states did this in one way or another, but you had very ambitious ACA implementation plans for the Affordable Care Act. I broke my own rule. And you also decided to go ahead with all of your plans to connect up across the health and the human services boundaries and make that eligibility across those programs for people. Other states have made a choice that doing health reform had to happen first. You had to do it all on its own. Do you have any words of wisdom to other states, reflections on whether it was a good idea to take them both on at once?
Well, it was a good idea. The words of wisdom I have is Colorado whiskey. It was a good idea because, again, our commitment was less about us, less about our programs, and the commitment was what do Coloradans who are struggling to overcome poverty need, how do they need it, and when do they need it? And when you focus on that and build your systems around those needs and those issues, the questions become pretty clear. So one of the things that we had in 2011 was a strength in many ways. It was a universal application for Medicaid, food assistance, Colorado Works, et cetera. Paper application, 32 pages long. Well, it was great. You could fill out that application and get all these programs that you might be eligible, including state-only programs. Except that it was a barrier because if you had a difficult time reading or maybe you were trying to manage 2 or 3 kids while you're filling out this application, you just say screw it and move on. We worked together to go from a 32-page application to an 8-page application. Now, some of you are like, those old school like us are like, wow, that's pretty cool, right? Down to 8 pages. But what we've set out to do with work support strategies is move beyond 20th century ways of applying for benefits. We've created an online application 24 hours a day, 7 days a week that we call Peak, that people can go on and again get begin the eligibility process for virtually all programs. And we've expanded PEAK using money from the Race to the Top Early Learning Challenge grant to include now early childhood programs so that families can go on to PEAK. Maybe they know about Medicaid because of this Affordable Care Act. They'll go on to PEAK, and PEAK will be intuitive and will say, based on the information you've provided us, you may also be eligible for free and reduced lunch for your third grader. You may also be eligible for WIC because you're expecting a child. Did you know about Colorado Works if you're seeking employment? And it will ask people what programs may help them and their families, and they can choose. That's the difference that we're trying to make, and Work Support Strategies has been terribly critical in helping us achieve that.
Thank you very much, Reggie. Sherry, can you tell us a little bit about the vision that North Carolina had for Work Support Strategies? You came to it with a broad direction already formed, I think.
That's correct. Thank you, Olivia. Our stories, it does compare to Colorado's. We're a state-supervised, county-administered system. We're about the 10th largest state in the nation, and we rely very heavily on our counties to administer all of our programs. Our path started about 7 years ago when the recession hit. We were seeing the numbers of people coming into our office increase exponentially across all programs. And we were seeing individuals and families that we had never seen before. Manufacturing jobs were leaving our state and folks weren't able to go back to work. And their demands and their requests of us were quite different than the demands and requests that we were accustomed to seeing in our local offices. We had started down the path and had bipartisan support in our state for IT solutions. We had 19 legacy systems in our state that were supporting our 5 core work support strategies programs. Many of these systems were 30 and 45 years old. We had one system where no one coming out of school knew the language that we were even talking about for which the IT system was written. We had folks that had been retired 5 and 10 years who were on contract to come back to work for us when an IT change needed to be made, something as simple as a COLA change in our FNS system. So we were really at a breaking point. And we thought IT was going to solve a lot of our problems. And in fact, it was a very necessary tool for us. But the closer and closer that we got to implementation and the deeper dive that we had to take across programs to get ready for that implementation, answering all the questions that our IT staff had for us when they were trying to write code, which meant we had to give them requirements. And we were looking at our requirements going, do we really want to give them this? Because we began to realize that there was a lot of work that we needed to do in terms of policy simplification and policy alignment. These were not new things to us. We had tried a number of times in the past to do work in these areas, but it always failed. And it always failed because it always took a back seat to the day-to-day work. And so what we saw through Work Support Strategies was an opportunity to get focused, and we had some real drivers in front of us. The increasing caseload. We had stories coming at us right and left from our counties. We had one of our county directors who said, we can't staff ourselves out of this situation. We can't hire enough people to handle the demand and keep working the way we're working. I had a county manager to call me one afternoon to say, you know, I trust our DSS director. She gives me good information. But if I look at the applications that we have taken in our county alone over the last couple of years, everybody in the county has applied for these benefits. I do not think that's true. And so we began to look at churn, and we began to use our data.
Can I stop you one moment? Because people may not have quite gotten what that story means. She said that the number of applications was more than the number in the county. What did you discover when you looked at that?
We discovered that people were losing their benefits and coming back and reapplying. The demand was so high in our offices, people were waiting long. Their phone calls weren't being returned necessarily as quickly as we would like for them to have been. And if families didn't experience change, sometimes they didn't understand the need to return the information that we were requesting, because it was pretty much, I have nothing to put on this paper because nothing has changed. And so we were losing people because of a lack of understanding in terms of their obligations obligation to report to us over different periods of time, which, by the way, are very different for each one of these different programs. 6 months for one, a quarter for another, you can go a year on another, nothing aligned, and it was very complicated and very complex for families to understand and appreciate. We were also trying to solve some of the wrong problems in North Carolina. We were looking at statewide call center functionality because counties simply, customer service was taking a dive. They couldn't answer their phones. They were busy processing cases. And we had pulled together work groups. County folks sat at the table with us. We brought in some IT folks. And we started down a path of saying, we've got to answer these phone calls. We've got to get the people in place so that we can improve our customer service. And when we really started looking at why individuals were calling us, they were only calling us for 2 reasons. Where are my benefits and when will I get them? And that's not something that IT can solve for us. And so the opportunity of having a grant like Work Support Strategies, it gave us the support, it gave us the focus, and it gave us the momentum to move forward on initiatives that we just simply hadn't been able to focus on in light of the experiences with the day-to-day work.
Can you give us one example of something that's different now? I know we're going to have lots of chance to go back and talk about many more things, but just one.
So one of our successes in North Carolina, we believe, is really the governance structure that we have put in place for all of our programs. We used to talk about the way we're organized, and in North Carolina, we're all under one umbrella agency, Health and Human Services. And you think that's great. But when you're working day to day, you still tend to work in your silos across divisions, Division of Medical Assistance, Division of Social Services, the Division of Child Care and Early Education. And so what we did was put together a governance structure. And basically the impetus for this governance structure was, if we're going to write policies and we're going to write procedures and we're going to make demands of our families, the same families across these programs, then let's make sure that we do it in the most family-friendly way that we can. And this governance structure means that these individuals who write these policies, who develop these forms, who request the IT changes, are together at the table and they're looking across programs and across services in order to determine what's best for the family. What happens in Medicaid when we change this child care policy? How do we coordinate and work together across programs? And so the realization was, it wasn't exactly about how we were organized, it was about how we managed our work.
Thank you very much. Deborah, can you tell us a little bit about why Rhode Island embarked on this work and what it is that got you interested?
Absolutely, Olivia. Thank you. It's so great to be here, and we're just so pleased to be part of the Work Support Strategies states. Not only have we learned so much from our colleagues, our Work Support Strategies, but all the other states. It's just been awesome. So Rhode Island's story is very similar, although obviously we're a very small state. What's interesting is I think the Rhode Island Department of Human Services had a history of being a very well-run organization, kind of leading up to 2007, 2008. The workers were well-trained, they managed their individual programs, they got good at what they did, and everything was in place. And then all of a sudden, 2007, 2008, huge retirements. Our staffing went from like 1,200 down to 800 or 900. The brain trust of the agency pretty much walked out the door. Everybody retired. The field operations was like, oh my gosh, we had no people left. So it was very significant. And then the economy. So in Rhode Island, that 2007, 2008, 2009 was very tumultuous. The caseloads, SNAP assistance in Rhode Island went from 40,000 caseload in 2008 up to, we're hovering right at 100,000 cases, 98,000 cases in Rhode Island in 2014. Our workers, our caseload for our staff, for SNAP, for example, if you talk to some of our experienced staff who have been here for years, 400 per worker maybe. Now, truly, over these past few years, we're 2,000 or 3,000 cases per worker. We were very similar, federal lawsuits for timeliness in 07, 08, and we began to really think about how can we modernize. Similar to what everyone else has said, workers can no longer do this. Our clients are not getting the benefits that they're eligible for and they deserve. We need to think differently. We started the modernization search, and lo and behold, we saw the Ford Foundation grant. And truly, it has been unbelievable in Rhode Island. Olivia made mention, or I think maybe Helen, as to the high-quality technical assistance that we have had the benefit of the past 3 years has been absolutely unbelievable. The technical assistance, the knowledge, the support, the constant support, it's just been an unbelievable experience. We've made many, many changes in Rhode Island, and truly, it's been through the assistance of the work support strategies, because in addition to all the change, we actually broke our state Medicaid agency, had always been DHS, and with the Affordable Care Act, lo and behold, Medicaid moved to our Executive Office of Health and Human Services. So at a very interesting, unique time, Medicaid moved away from us. So through work support strategies, we've learned, we've just had so much knowledge, working together, et cetera, et cetera.
Can you give us an example of something that's different?
Yes, so one major example, I know we'll have a lot of time to talk about our successes, is the business process redesign in Rhode Island. Through the 2011 planning year with work support strategies, we had the opportunity, I believe an unbelievable Rhode Island team who was very experienced in operations, had the opportunity to travel to other states, New Mexico, Idaho, Washington State. And we got the opportunity to say, my goodness, if the staff focuses on a task versus that caseload, wow, things can really change. So we listened, we learned, we studied, and 3 years later, July 7th, 2014, we rolled out the whole task base, get ready for our new eligibility system. We're seeing, we had made improvements in same-day service, but we're seeing good improvements, wait time for clients, and we're just very excited about the results that we're seeing with our redesign, and I'm sure I'll have an opportunity to talk more about that.
Let me ask one more question, just for people who, the last thing you said was about making dramatic changes in how workers in local offices process the paper that comes to them. And you said you've done that, and you've done a big technology improvement, and Rhode Island, of course, like Colorado and Illinois, has implemented the Medicaid expansion under the Affordable Care Act and dramatic Affordable Care Act rollout. Can I ask you the same question I asked Reggie? Was it a good idea to do all those things at once? And what advice do you have for other states?
Yes. It was a good idea, but that doesn't mean it's easy. It means we all work a lot of hours. It means we all collaborate. It means that we all, and we've been very fortunate to have Director Powell, our Deputy Director Russo is with us today, Secretary Costantino on the Medicaid side. We've just been so fortunate to have leaders that are just encouraging us to keep talking, keep learning. It's huge. It's huge. But I think it is the right thing to do. And the other practical piece is the funding, the financial funding. And we are building a brand new eligibility system. It's all integrated. The state exchange up front, apply for health plan, Medicaid, and go right through and apply for all your other human service programs. And we've been able to take advantage of the enhanced funding, which obviously was very key.
The enhanced funding being the federal resources that are available associated with the Affordable Care Act for improvements in your computer system across the board.
Yes.
Thank you, Deb. Karama, thank you very much for being here. I know you've been with South Carolina Social Services for quite a number of years, so you've also seen the before and the after before you came to this project. Can you say a little bit about what it was like before and what you see as the big accomplishments?
Okay, so South Carolina, before we did WSS, or Work Support Strategies, some images for you guys to have. So we had, you walk into a county office and a client would have to be in two lines if they were applying for SNAP and TANF or in Medicaid. So Medicaid is a totally separate agency in our state. So the client would come in, hand all their verification to the DSS worker for SNAP and TANF. And that line, depending on the county size, could be an hour. Then they would get out of that line and go stand in the Medicaid line to get services and turn in essentially the same verifications or very similar. The interesting part of that is the workers from both agencies were sitting right next to each other, no wall, no nothing dividing them. So there are opportunities to help the client after they've waited that long period of time, but we didn't do that. Another image we had hand sanitizer on one side that said DHHS only or DSS only. We had hallways where we looked at each other like, you're DSS, you can't walk down this hallway, this is a DHHS hallway. So before WSS, we saw there were a lot of opportunities for change and collaboration between the two agencies, but we had the same problem everybody else had: lack of resources, higher caseloads, change in administration, et cetera. Once WSS came on board, I think our biggest success so far is just the level of communication and collaboration between the two agencies. We may still have, DHHS on hand sanitizer, but we allow the other agency to use it and vice versa. And people can actually walk down any hallway they want. But more importantly, our clients can come in. We have 2 pilot counties so far. And in those counties, our clients can come in and they can get in any line after they talk to the navigator, who will determine why they're there and direct them to where they need to go. And any worker behind the window, be it a HHS employee or DSS employee, can help that client and get the process started so they're not in 2 lines trying to submit the same information for benefits.
And even before you revamped the local offices, you did some work using automated systems and the express lane eligibility possibility to get children signed up, right?
Right. So if you guys can just imagine, if we weren't sharing in the lobby, we definitely weren't sharing behind the scenes. So one of our major accomplishments is a data sharing agreement with both agencies, where we can provide information, like she said, for express lane eligibility, and just anything that we need. We have that buy-in now from the state level all the way down to the county level.
So when a child is on one of the programs and doesn't have the other, you can do that pretty automatically
Right.
by sharing data now.
It's automatically done behind the scenes. Another image I think you guys will find interesting is we have people, some of our workers, who felt before WSS they were doing drug deals to share information behind the scenes because they felt it was just wrong. I can't give
So
this
they weren't doing
information.
it, it
They
felt
weren't
that
actually.
way.
They just feeling it.
Just in case there's South Carolina facts, I want to make sure.
They felt that way. Because, the culture was, we don't share. We just don't share data, we don't share information. But now, it's an open environment where we can actually collaborate and focus on the client experience and on service delivery.
Thank you very much. Jen, how do you see the journey you've been on in Illinois? Why did you get involved and what's different?
I see it as a wild roller coaster. It's been a lot of fun, a lot of ups and a lot of downs. Our drive to apply in Illinois is very similar to what the other states have shared. We had decreased staffing, we had increased caseloads in response to the recession, and things were unmanageable. In our local offices, there was really a fixation on can't. We can't do anything differently without more resources. We just have to kind of keep trudging along because staff were just overwhelmed. There wasn't really time. No one really had the energy to step back and see what can be changed. And really the customers ultimately suffered because they had long waits, lost paperwork, had to apply multiple times. But the truth was there was a lot of low-hanging fruit out there. There were a lot of paper logs that people were keeping because they've always kept it. And no one actually looks at them, but they actually have to keep that. And we also have an evil entity in Illinois known as Springfield. Why do you do this? Springfield. But things have changed. And so really kind of looking at that fruit. So when the was written for Illinois, I think about 13 to 15 people saying, hey, of a large state agency. We were able to hire dedicated staff who were able to really focus on integration, focus on improvements in the field, in policy, and elsewhere. And it overall provided us a structure to look closely at policy. When can we change other things in the future? Re-engineering. to affect what we were doing. We began looking at offices, working with staff in the offices. The folks on the front lines are the ones who was working, what wasn't working, what needs to be changed. And we learned, we tested things, we planned, we worked on it. And thank goodness we had a small amount of window to do this, because when WSS came out, there was this thing that had passed called the Affordable Care Act, and it was like, oh yay, health insurance for everybody, that's going to be great. But it took us a while to really understand the tremendous impact that that was going to have on our systems. So gradually, ACA pretty much took over our lives, and was really a huge opportunity, but it blew up our world. On October 1st of last year, we had to implement new policy. We took advantage of the enhanced federal funding to implement a brand new system, essential to replace our 35-plus-year-old legacy system. And we also expanded Medicaid and had a large number of newly eligible come on. So our world blew up, but because of work support strategies, we knew how we wanted to put it back together, what our vision was, what we were ultimately aiming for. We're not there yet. I definitely want to kind of take a nap and wake up in 2017. I think things will be a lot better then. But we do have a new system. We have new business processes. We have new staff. Part of this effort has been to really advocate for additional staffing to handle the demand that we face. The new and the experienced staff to finally get some more resources in the offices. And we have newly eligible. We have enrolled almost 500,000 newly eligible. The original predictions were that we would have about 300,000 over a 3-year period, and we're at 500,000, so still some work to do on that data element, but it's overall a success. And we're working towards phase 2 of our new system, where we hope to be able to really implement the full vision of what we're looking to accomplish to better serve our customers and to create a more supportive environment for our staff.
So what would your advice be to other states about blowing up your entire world at once and deciding to implement a new system, enroll 500,000 new people, and keep the link to human services, changing how local offices operate at the same time?
Go for it. You know, if we could go back in time, I wish we had maybe started some of these things earlier, before ACA came on board, because obviously there are a lot of challenges to doing it all at once. But considering what we faced with the recession, when ACA and the enhanced funding came available, we couldn't wait any longer. Our customers couldn't wait any longer. Our staff didn't have the time for us to plan and lay things out in a neat little 10-year plan. We had to do it. And really, my advice to other states and other entities is take on something. You know, most of our work in the states is about trying to keep our head above water, and that's really challenging. That can take 110, 120% of our time, but there are lots of opportunities out there, from private foundation grants like this, from federal grants, from USDA, from CMS, from others, and take on something. Pick one thing and take on to it. Take it on, because it really invigorates staff. It's exciting to be doing something proactive, something progressive, moving the needle forward, and that's really worth it for the sake of our staff and for the customers we serve.
Thank you very much. I think you can already hear what an extraordinary group of public servants we have here. I'm going to ask Bob Reischauer to offer us some comments.
Thank you, Olivia, and I thank you and your colleagues for inviting me to participate in this forum and give me the chance to learn more about this demonstration from those who are leading it at the state level, people who have their toes in the mud, but their eyes looking at the surrounding countryside and the near-term horizon, but not their eyes in the clouds. And the discussion we've had here today and the previous one that the six of us had on the phone on Friday led me to a very unusual feeling. I'm a certified Washington cynic, and you know, listening to this, I came away with a tremendous positive feeling about what's happening and what is possible. And let me just sort of summarize 4 lessons here for you that struck me. And the first is that even in a policy environment that is extremely inhospitable, positive and significant change is possible. And we've lived in this country saying, oh, good Lord, we have this great problem before us, we can't do anything, or that problem. And if you think about it, you know, things are, this environment is really very inhospitable. We have a period, an era of hyper-partisanship where political leaders seem more willing to sacrifice what both parties view as the common good for very short-run political advantage. We have continued budgetary pressure, very steep recession, followed by a very weak recovery, which limited the opportunities at the federal level and at the state level when we extract the temporary stimulus kinds of program. We have some rather strained relationships between federal agencies and states where some of the trust that existed in past eras just isn't there anymore. And then we have a public that is skeptical about government's capacity to do anything in an efficient and equitable way. Of course, that was just underscored by the early rollout of the Affordable Care Act. I mean, just stumbling through the enrollment process. And notwithstanding all of that, you know, as you've heard, there have been some very significant and important steps forward in an area that people have been talking about and realizing was the right way to go for a long, long time. Second observation is that it turns out that a time of policy turmoil, which was provided by the recession and the Affordable Care Act, may in fact be a good time to pursue structural change. The traditional view, of course, is that when there's a big activity going on in one area, everybody else hunkers down and plays defense or else tries to make changes that are under the radar screen but are only in their silos so nobody will notice it. And the idea of going across silos or across levels of government just isn't there. But what we see in the experience of these 5 states is, in fact, when there is a big policy change and turmoil brought along by the Affordable Care Act, the connective tissue across departments and agencies and between the states and the federal government, in fact, might be more flexible than at other times and open to change, and provides a rationale that everybody can understand on rethinking and reassessing how different programs interact with each other and interconnect, and brings out more collaboration and cooperation than one would expect. We've also heard that the Affordable Care Act offered resources and tools that are unavailable at other times, and you can piggyback on them. And you know, the Affordable Care Act did, for me anyway, a very important thing, which is, unlike any of these other programs, participation is mandatory. You have to get health insurance or you're penalized one way or another. So you have a connection with groups of people that previously don't participate, don't know about anything, and it opens up a huge opportunity. And one can't, we've heard a lot about how SNAP enrollment has increased tremendously, and it sounds like everybody and their brother is participating in the program, but of course that's not true. And in the other social areas, it's far from true. And then you read in these Kaiser surveys that, lo and behold, 9 out of 10 uninsured people in America don't know when the open enrollment period is, and 53% of them don't even know that there is a subsidy provided for premiums if your income is low. These folks, by and large, are trying to survive day to day, hour to hour, and they don't, have access to the same kinds of information that we have on things that might help them. And you hear from this panel how important this is. Oh, you're in this? Well, let me tell you about that. That's a very important step forward. Third, change that involves the way different agencies and programs within a state interact with each other may be best encouraged externally. And by that I mean not by the governor, not by this party or that party, or even by federal incentives, but by neutral sources such as the foundations who, you know, don't have, in a sense, a dog in the fight and are sort of incentivizing with quite modest amounts of resources that which has existed just below the surface, and that is the will to make things work better and go across the hurdles of interagency or political boundaries. And, you know, what I see as most positive here is the unleashing of this will that has occurred. I mean, the fact that as many states applied in the first round as they did, and that is very encouraging to then to see the states that really have made a lot out of this. Final point would be, and this didn't come out as much in this discussion as it did on the phone, the importance of moving forward at a deliberate but measured pace, as opposed to trying to storm the barricades, you know, in a short period of time, or not having any firm deadlines about what you have to do by when, in which case sort of, well, let's have another meeting, you know, let's drag this thing out. Finally, while it's time to celebrate accomplishments, there are significant challenges, as people have noted before, and you know, one that I think has to be guarded against very significantly is to keep partisan politics out of this implementation and to sell it as government efficiency and improved equity. And secondly is to keep a hind eye out for interest groups' pressures, because interest groups focus, like things to be in a neat package in one agency or another where their power to influence is maximized. And sort of this makes it a much more complicated task for them, and I would expect some pushback on their part. That's.
Thank you very much. It's interesting, in all these years of working with the states, that point about how times of turmoil and conflict can be good for change. While I thought about it in other contexts, I never really thought it in these words here. When I worked in the U.S. Department of Health and Human Services, and I was very worried one day about a conflict, about a program I cared about, and somebody said to me, you know, people go to the movies for the conflicts, meaning times of conflict elevate the attention, the conversation, and they unstick where things were before. So I'm now going to ask a few questions of the panel, and then soon turn it over to you in the audience and to those on the web. I'm sure we're printing out web questions, and I'll have some of them soon. I don't know if we have any of them yet, but feel free to jot them down, and for those of you in the room, start making your notes about what to ask. So I think my first question is going to pick up on one of Bob's points about challenges ahead. He talked about the political environment, and I just want to ask people on the panel, we have one state, North Carolina, where the project has remained important through a change in gubernatorial administration, a change of parties, other states with governors and legislatures of both parties, and I wonder if people can say a little bit about what makes it appealing in your context, what makes it appealing across party lines, and what are the political challenges you encounter? Maybe a little bit about how you talk with legislators or with the public about these programs. Does anybody want to start? Sherry, did you want to start?
I'll start. Because yes, this has for us transcended across actually 3 administrations, if you take it back to when we first started planning our IT. Lots of challenges and opportunities. I think the one thing that keeps us focused is the fact that the tenets of what we're trying to achieve are universal, they're bipartisan, and when we started down this path, talking about families and talking about children. We weren't talking about policies and processes. We weren't talking about our agencies. We were talking about the individuals that we serve every day. And I think one of the things that I'm most proud of is those tenets have stood the test of time. They stood the test of time through some very bumpy IT implementations. They stood the test of time through conversations about budgets and personnel and administration. And just so that you have some understanding of what I mean when I talk about our tenants. Our tenants are not written bureaucratically. They're not written with jargon about people, except for our families. And it's basic. Families will tell their story once and receive the services that they need. That's the first and foremost. And no matter who you are, or where you sit, or what agency you sit with, or what side of the aisle you sit on, if a family has a need, it's government's responsibility to deliver that benefit and assure the safety and security for that family and for those children. And we all want to see that. And we keep that in the forefront of our decision making, of how we work with each other across our programs, and how we interact with our counties who are administering these services.
So Reggie, did you want to comment? Or
I was thinking as Sherry was speaking, Colorado's experience was very similar. This is a bipartisan issue. Colorado, again, a local controlled state. We're made up of locally elected county commissioners who are partisan, Republicans and Democrats. Turns out one thing they have in common at the local level is they don't want people standing in their lobbies waiting for services to which their citizens are entitled to. The computer system I talked about not working cut across partisan aisles. Colorado is also pretty unique. We were the only state in the country that had bipartisan support to establish our healthcare exchange. Came through a Republican-controlled House, was approved by a Democrat-controlled Senate, and signed into law by a Democrat governor. And so this is an issue that cuts across both parties in our state. It cuts across local, state, and federal levels of government and brings us an opportunity to put aside partisanship and work together. The other thing I was thinking about when you mentioned interest groups, and I know Washington interest groups might be different than Colorado interest groups, but one of the things that we did was to engage interest groups who used to be the people banging on the door to get government to change, to say, you know what, Hunger-Free Task Force, why don't we give you opportunities to sign people up for benefits in your food banks and other locations rather than taking time and energy to come and bang on the doors? And they became a part of the solution, and their advocacy shifted from being the adversary to being the partner, which has been really critical to the success of Coloradans.
So I want to pull a couple of points out from that and then see if there's anybody else who wants to comment. Some of it is probably special to these particular states. I mean, Colorado is probably not typical, as you said, in having the ACA expansion be nonpartisan. But the theme I hear over and over is the theme that having long lines and unresponsive and bureaucratic government service delivery isn't popular with anybody. So that in some ways, that piece of it, I think people have been very successful at addressing with both county and state officials of both parties. Do you want to comment?
Yeah, I do. Olivia. Thank you. And for us in Rhode Island, we talked about the business process re-engineering, and what was so significant for us is our workers, and I look at the team there who worked so hard, are now administering eligibility for all programs. We made that shift. And I think as we transition into a new administration and for service delivery, that's something we've worked so hard on. I really don't see that going backwards. So I think from the bottom up, that change has been shifted, and that's going to be very difficult to undo. But I also agree with what everyone said. It's going to be very hard to not understand the increased efficiencies and the better services to our clients. So I'm optimistic that we'll just keep going.
So I want to ask something else from slightly a different angle, which is also, as Bob said, there have been accomplishments. There are clearly also remaining challenges, as everybody was honest about. And I think one of the things that everybody here has been willing to do is try some things that didn't work. And everyone here is very honest about that in private, so I'm going to see if people can think of something you tried that didn't work or didn't work the way you thought it was going to work, that nonetheless you learned from, and it was a good thing in the end. Because I think one of people's criticisms of government is it can't innovate because no one's ever willing to take a risk. So I wonder if anyone has an example you could give of a risk or an experiment that didn't work as you thought it was going to work?
Well, I would say in South Carolina, we tried to put together a joint application because, again, we are two separate agencies, and it's something we worked on really hard, and we realized that, you know what, perhaps we need to improve our communication and collaboration and processes as we're trying to streamline service delivery for our clients. So what we decided, we didn't give up on that joint application, but what we have done is we're going to, attack, I guess, the project in a different way using the lessons that we've currently learned on collaboration and what our clients need in our state.
So you tried something, it wasn't the right moment for it, it was too hard, and you learned from that to step back and try something else. Jen?
When we first started the business process reengineering efforts, we gave a lot of local control. We worked with the staff in the local offices and allowed each office to kind of come up with their own type of system. And that was very informative. We tested a lot from that. And then when we rolled out our new eligibility system, we also let the offices select whether they wanted to be task-based, caseload-based, or some hybrid. And we had 80 offices, and we probably had 95 or so different business processes happening. And that was not successful. It made the system much more complicated than it needed to be, because by trying to accommodate every business model, we lost a lot of the advantages that would have been brought from the system if we had gone with one. And we also realized that a lot of the local offices didn't necessarily want to come up with their own system and make all these choices and design something. They looked to us and said, what works? Tell us what works and how to do it, and we'll go do it. We don't have time to test and be all innovative. So we are shifting to more of a standardized set of processes throughout the offices, and we'll let you know in a few months if that works or not, but what we tried before didn't work, so now it's time for the next iteration.
Can you just say a little bit more about what it's like in a state leadership role to try things in that kind of an experimental way and then, move away from them and try something else? That's a hard thing to do in the public sector. People can criticize or see it as waffling. How did you do that?
I think it's better to take the criticism from changing and walking away from something that didn't work than to stick with something that wasn't working for the sake of not changing and being hard-headed about it. I mean, I think we phrase this whole thing as pilots and as learning and as trying different things, and because we worked very closely with the staff on the ground. And they were the ones who gave us a lot of information about what was working and what didn't. So I think it would have been worse if they were giving us feedback and we, stubbornly stuck with something than what we did, where we brought a group together from across the state and said, okay, let's sit down, let's figure out standardized processes that will work. And people have really kind of rolled with that because, again, they're the ones on the ground, they're seeing what is working and what's not working. So they're hungry for, more successful processes.
Any examples over here? Reggie?
A couple of things come to mind for me. In Colorado, we have similar issues being a state-supervised, county-administered system, 64 counties. And we've had a fairly flexible approach to how counties may choose to set up their own eligibility processes. Rather than doing a statewide business process reengineering, we've done it county by county by county. There's some strengths to that because there are lessons learned that you get from some counties, but there are lessons learned you get from all counties. Some of them are lessons that you want not to replicate again. But other lessons are really innovative ideas that you might not have tried if you had done it one way. At the same time, we're also struggling with, well, if a county is getting exceptional performance and another county is not, how long do you allow that other county to create their own way of doing things before you roll out standardization? And so we're really struggling with where to come down on that issue. The other thing that I was going to mention, and I'm almost embarrassed to say it because it sounds so basic, but when we went into timeliness and did all of these changes with the computer system and business process reengineering and a variety of other changes, my assumption was that if we put these new processes in place, we would improve timeliness as well as accuracy. And what we learned was, yes, we increased timeliness, but we didn't improve accuracy. As a matter of fact, in some of our programs, accuracy went backwards. And if I could go back 4 years ago, I would put timeliness and accuracy as equal components and make certain that we were fixing both at the same time rather than assuming that one would fix the other.
And so you're discovering you have to work on both of them together in order
Exactly.
to get better. Sherry, go ahead, and then I'll ask one more last question before going on.
And just to pick up on the notion of communication, don't assume because you're using the same words that you're saying the same thing. There were lots of times where we had to just stop and pause and take a deep dive and have just conversations about 2 words, learning curve, or universal, or just don't underestimate what people are thinking and create opportunities that are safe to have conversations so that you really understand where all the partners and stakeholders at the table are coming from.
So let me just ask the same kind of thing I asked Jen, Sherry. How do you actually create a safe environment to have those conversations in a public agency where probably everybody you're dealing with, somebody works for somebody else and thinks they're going to be in trouble? Can you give us any flavor of how you do that?
I think it goes back to trust and transparency. You've got to tell the whole story, the good, the bad, and the ugly, and you've got to listen to the good, the bad, and the ugly. And you got to invite people to the table to help you solve your problems and solve your issues as they come up.
Yes.
So, well, I'll ask one more thing. I'm going to invite people in a second. Are we going to have people, I guess we're going to have people line up at the mic, so maybe start doing that while I ask one more question. We've talked a lot about 2 of the programs in the Work Support Strategies package, health insurance and nutritional assistance. We haven't yet talked as much about child care assistance, which obviously is crucial to working families. It's in a different financial place than the others. My colleague Hannah Matthews at CLASP just has a great paper out that's on the CLASP website that says, sadly, we're down to the lowest number of children receiving child care assistance in a dozen years. So the federal money is not in the same situation as the others. Nonetheless, a number of states identified important ways to do some of the same things, help families who are eligible not jump through as many hoops. And I wonder, I know Deb might want to say some things on behalf of Rhode Island. A couple other people might want to comment.
Thank you, Olivia. Yes, we've taken advantage of the policy assistance on the child care side, and we looked at the policy alignments and also in the beginning our requirements for documentation, very significant, document work schedules, et cetera, et cetera. So it's not to say that we are sacrificing program integrity issues, but we're looking for other ways to get the verification to make it easier and allow our recipients to get the child care that they need. So we've worked quite a bit on alignment of policy, aligning recertification, looking at the seasonal prospective budgeting, and we've looked at Equifax as an access to income, income verify online, over the internet. Are they working? What's the income? To try to reduce the barriers to child care.
So you looked in a very fine-tuned way at what are the things that are holding people up, keeping them from getting benefits, and then you tried to fix each one of those.
Yes.
Sherry, did you want to comment?
Yeah.
And Jen wants to.
Sure. I think our conversations go all the way back to our policy alignment work. It's very true that we're not getting a lot of new money. And in North Carolina, we braid lots of different funding streams in order to increase access to child care. We use a portion of our social services block grant, our TANF dollars, our child development block grant funding. There are a lot of state dollars that go into the administration of child care. And we know that there are not going to be lots of new opportunities for funding, but yet we want to see more children having access to quality child care. So to the extent that we can decrease the administration of many of these programs, use information across program lines. If a family's already getting SNAP, then to be for sure they're eligible for child care. Let's not repeat the process, repeat the requirements of administration. Let's use those administrative dollars to increase access to child care. And that is the impetus of where we're trying to come from to really work across these program areas to reduce the administration across the board.
Okay. Jen, you want the last word on this topic, and then we'll go to the audience for questions.
I think the challenges in childcare are very similar to what the challenges are in SNAP and medical. But as far as program alignment, there's a lot of low-hanging fruit. There's a lot of opportunities to improve because at least in Illinois, we hadn't really looked at them together prior to this project. We have grand visions of doing data matches and sending out letters and encouraging people who are enrolled in one, not the other, to apply. But on a basic level, we're rolling out new eligibility systems for both programs. Let's make sure that they can talk or that we have cross-access to them. Where are opportunities that if something is verified in one program, the other program can use it and to continue that eligibility based on the information in the other thing. So there's a lot of work to do on it, but this project has really kind of started the conversations and helped us looked at it in the framework of these are working families, what can we do to support them and get them the full package?
Thank you very much. So I've gotten a couple questions from the web and also a note that the webcast is having technical difficulties which we're trying to fix, so I apologize to those on the web, but let me go next to a question here in the room. If you can identify yourself and ask the question crisply, and we'll get a couple answers in.
Hi, I'm Jeff Hayes from the Institute for Women's Policy Research. I have a question primarily for Rhode Island. I was wondering how you've been integrating your new paid family leave program, temporary caregiver insurance, into these other programs, and whether you see interactions between that one and the programs we've been discussing in more depth.
So I'm sorry, I didn't get the whole thing.
Your paid family leave, the temporary caregiver insurance, is that being integrated with these other programs, or are you seeing interactions with it as it starts to be implemented?
You know, I apologize, I am not familiar with that.
So the paid leave program is what you're asking about?
Insurance?
So Rhode Island is one of three states that have paid
started in
family
January,
leave.
right.
Right, operated through the insurance.
It's TDI, TCI.
Right, operated through the
Okay.
unemployment insurance opportunity.
So it's out of a
that's an
completely different
interesting
department,
future.
that's why I was wondering, right.
Yeah.
Right, no, it's an interesting
A very
future
good
set of
question. I'm
questions,
sorry, I'm not familiar with that.
but one that sounds worth thinking about.
Absolutely.
Go over here.
Hi, I'm Cynthia Woodside with the American Public Human Services Association, and of course, we're very proud of all our members who are doing such great stuff. And I wanted to take this opportunity to kind of tap into your brains and your experience for a minute. And Jen, you started talking about this. I mean, I'm wondering with the enactment of the Workforce Innovation and Opportunity Act, and the plan and the desire to start integrating, coordinating, work and employment programs, across the state, whether or not the experience that you've had with this project and other programs could really serve as the basis for doing more integration in that area and bringing in the human services piece to the workforce programs, or whether or not you think that separate entity would be more problematic than what you've done so far, would, smooth the way.
Okay, a topic that lots of my colleagues at CLASP have lots of opinions on too, but let me go to the state leaders here. Anybody want to comment on the opportunity to connect to the workforce system, job training, given that there's new legislation there? Reggie, then Deb, and I'll get anybody else in.
So thank you, Cynthia, another one of the great APHSA staff. Glad that you're here. First of all, the federal law is a brand new federal law, and so at least in Colorado, and I would guess that my state colleagues share this, we're all still sort of absorbing it. What does it mean? How do we interpret it? And what do we do about it? We're in the very early stages of having those conversations. But I will say this in terms of my belief. Turns out when I'm not here, I'm a dad of 3 kids. My wife works full-time as well. And work is very, very important to us. But we don't think about work as being all-encompassing in everything in our lives. And as a working parent, I think a lot about my children's needs. I guess where I'm going with that is to say, we ought to be careful not to think that because there's this new federal law that says all work should be connected to one another, that it doesn't take all of state government to understand the whole of kids, families, including especially working families, and that all of us need to surround them from their perspective and support them in the work that they do. Some of you might know I'm a 2-generation fellow with the Aspen Institute, and we believe very strongly in making certain that we have the right economic support, but that it's also tied to early childhood opportunities, early learning opportunities. And that isn't just one state agency or one federal program. That's all of us figuring all of that out together to make sure that working families are best prepared to be successful.
So I'm going to say one quick thing, and then I think there was someone else. Deb, was it you who also wanted to comment? It was Sherry. Okay. The new workforce legislation, it's again an example of Bob's point that maybe when things are changed, there's an opportunity to make big change. It includes provisions that are intended to make post-secondary education and training services much more accessible to low-skilled workers, which is often who my colleagues here see. And CLASP is planning, has already done some writing, is planning a lot more on that. And my perspective, which I'll be interested in how people see it, is there's always a balancing act when you're trying to connect up programs in an effective way. You have to set priorities, because if you try to do everything, you'll fail. But you have to have a big vision and use the lessons. You know, if we've succeeded this far, how do we make that next connection? So I think it will be really interesting to hear how people want to use some of the lessons they've had as they look forward. It was Sherry who wanted to comment?
Yep.
Did you want to?
And I was just going to say, a wonderful opportunity, and we're beginning to see it and have been seeing it for quite some time. As a person that is very familiar with the Work First program and now learning more in my new role about vocational rehab and services for the blind and senior employment programs, getting lots of feedback from employers in the community about the need for a better, stronger, more coordinated system in coordinating with them, because they're reaching out and are very interested in employing individuals that we're working with, but we're knocking on their door in many different ways, coming from many different sides of the house in terms of programs and services. So I think the same kind of coordinated effort about wrapping services around the individuals and giving individuals the opportunity to keep those services in place for the duration of time for which they're eligible is sort of a no wrong door approach for those that are seeking employment as well. Because I know, at least in our system, you're likely to get what you get because of the door that you walk through. So if you walk through a TANF door, TANF is more likely to serve you. If you walk through a vocational rehab door, then vocational rehab is going to try to serve you. And oftentimes those doors or that opportunity needs to transcend and be decided more from an assessment of what's best for that individual, not necessarily based on the door that they walk through. So I think there's a huge opportunity there.
I'm going to go to the microphone, and then I'm going to do a question from the web. Go ahead.
Great, thank you. I'm Josh Protas from Mazon, a Jewish Response to Hunger. And I know that there are many other folks here in the room today from other nonprofit and charitable groups. So I was wondering if the panelists could speak a little bit about how they have engaged and included nonprofit organizations in the process for the different state efforts and opportunities to expand that as well.
Great. Anybody want? I'm actually going to make one comment and then go to anybody who wants, which is that it seems to me that one of the things people have learned about the ways that don't work to include nonprofit and charitable groups is to have them work on bringing people in at the front end while the back end is still all messed up. So one of the lessons has been about how to fix in ways that make it possible to serve families effectively throughout. But I think there's a lot of different ideas here. Jen?
We work very closely with advocacy organizations in Illinois and nationally through a Social Services Advisory Council. It's actually mandated by state law, but we meet regularly and have subcommittees that focus on issues like cash, SNAP, and medical in the local offices. And we have had tremendous success by keeping them very closely in the conversation, keeping them informed of what's happening at every step of the way. And I think through those conversations, they've got a good understanding that we're trying to do something big. We're trying to replace our system. We're trying to really improve the benefit delivery system for the residents of Illinois. And because of that, they've cut us some slack when we've hit bumps along the road. So because we've let them know what we're doing every step of the way, when we developed a backlog because of the Affordable Care Act, they understood. When we developed a SNAP backlog associated with that, they didn't jump right to the courts to sue us. They actually supported us trying to buy some more time from FNS, from Food and Nutrition Services, when they pressured us a little bit. And that has really helped a lot. And they've also got a fantastic perspective. When we were talking about the delays, one of the advocates actually said, I worked in the 1980s a lot on Medicaid applications, and I represented so many people who could only get health insurance if they proved that they were disabled, and many people struggled with that. If somebody had told me in the 1980s that we will eventually provide health insurance to everybody, but they might have to wait 4 months to get that, I would have said, oh my God, sign me up. They were so excited about it. So when they've got a perspective like that and they're able to keep the bigger picture in mind and really know that we're all on the same page, what we're trying to accomplish, then they're going to be with us through the challenges that are along the way.
They were telling you 4 months wasn't okay if it stayed that, right?
Right, because we're making progress, yeah. So they walk the fine line between understanding but keeping the pressure on us, but that actually can be helpful when we're asking for more resources or something to have that partnership.
Anybody else want to add? Deb?
So in Rhode Island, just like Jen mentioned in Illinois, we're very committed to the advocacy, our community partners, and we've had many advisory groups, and we participate. And just like Jen, familiar with work support strategies and the changes that we've been trying to make. And to bring it a step further, we also bring in some of our advocacy community to test our online application. So as we've been moving through the creation of the eligibility system, we've had the advocates come in and our community stakeholders come in, experiment, sit down before the technology is done. So they've been very, very valuable partners in making sure that our applications look good, are accessible, and so on. So they have been wonderful partners.
Short comment, Reggie, then
Sure,
I'm
in
going to do a web question and then one more.
In Colorado, as I said earlier, our nonprofits have been important partners, not only in many of the ways that you heard about in Illinois and Rhode Island, but also saying to them, because Peak is online, it's available online, put a computer terminal in your office. When you have clients who are in your office, get them to sit down and help them with the eligibility, with the application process, excuse me. We also are engaging them to better understand so that clients that they're working with who are applying have the right forms in the right way at the right time, which only smooths out the process for the client and for our county partners in getting that application done timely. And our nonprofit partners have really been amazing at stepping up and helping us to do that. And lastly, on the Medicaid side, many of the nonprofit partners have become, I'm not going to get the term right, Medicaid navigators? Did I say it right?
Yes.
Nice. Healthcare policy is in the room, so I'm a little sensitive about talking about their programs, but also another opportunity to be a part of the solution. You know who the individuals are who are eligible, who would benefit from these programs. Let us empower you by giving you the tools that you need to help them get these programs the right way at the right time as they identify what's right for them.
Great. So I'm going to ask one web question, get a couple quick answers, get one question in the room, and then I'm going to give people a very quick last word and end with Bob for his reflections. So the question from the web takes us back to childcare and says, given the volume and the issues when you cross-train eligibility workers to know a lot of programs, how do your agencies address parent education and the importance of quality? That is, if we're focusing on making sure that low-income working parents can get the whole package, how do we also focus on ensuring that kids are in quality programs? And I know that's a very big question, and I would say from my own perspective that it's that figuring out how to connect on both levels is something many states are in the middle of, but I suspect there are some early lessons, maybe from Reggie, or Deb has some comments too, Sherry might, Jen might. So why don't we get a couple quick comments on that one? Do you want to start, Deb?
I will. I'll be real quick. I'm just thinking race to the top, and I'm looking at Deb Anthus, and so Rhode Island is very immersed in race to the top, and we are doing so much with quality rating. And Bright Stars incorporating it into our rules. So fortunately, the combination of the work support strategies, race to the top, childcare, we've been working very hard at the quality issue, actually incorporating it into the rules, et cetera, et cetera.
So you're finding that having stabilized childcare a little bit by making it not making families be able to keep it longer is helping you link it up to the race to the top work.
Yes.
That's great. Yes. That's great to hear. Reggie, did you want to add anything?
Similar in Colorado, but look, here's the issue. Childcare started as a formalized process back during World War II, right, when women for the first time in our country's history went aggressively into the workplace. And it's been a critical work support for 80 years in our country. Go back about 50 years ago, we started to research and understand that children, particularly kids from low-income families who have high-quality child care experiences, are more prepared for school, all kinds of benefits. I won't begin the lecture on all of that. What we now need to understand in the 21st century is that child care needs to be both a work support and an early learning strategy. We need to move beyond picking one or the other as being the primary objective, and we need to share both goals. And that's what we're doing in Colorado with combining Race to the Top, Early Learning Challenge Grant funds, and priorities with work support strategies. And our goal is to help more Colorado kids from low-income families have access to high-quality childcare. We're at about 21% currently of kids in child care assistance program in a 3, 4, or 5-star facility. Our goal is by the end of June to be at over 30%. And our goal is going to be even higher. It's about helping child care providers to be successful. It's about making sure that we have the right resources to fund high-quality child care. And it's also about helping parents be better consumers about child care, understand why it's important, and help them to get access to high-quality child care in their neighborhood.
Well, there's obviously lots more to say about this particular question, but I think that's a start on where we might go with it. And let's take one more question.
Lisa Hamler-Fugit from the Ohio Association of Food Banks, and I want to thank each of the funders that have made this collaboration possible, and to all of the states for your risk-taking and your very frank statements about your successes, as well as some challenges that you face. This is really looking forward as we talk about these being work support programs, and would encourage the Work Supports Initiative to really look at the next steps of education, training, and what it looks like to help low-income families build their human capital and move up into the economic mainstream. This is a question for the panelists whose states have expanded Medicaid. Are there any thoughts or processes happening in your states now to transition Medicaid recipients into the marketplace?
Meaning people are not quite sure what the question means. So people in the expanded Medicaid.
In the expanded Medicaid, when their incomes increase, do you have plans as far as a seamless or as close to a seamless transition to move these beneficiaries into the private marketplace?
I see. So the question is, if people have worked on connecting horizontally, making sure that you're getting the whole package of supports, what about vertically? What about as your income changes? And I don't know that people here will give the technical answer, but I suspect that the answer is you've got a lot of strategies for doing it. Does anybody want to comment?
I can just say.
Yeah.
We already do that in Illinois for applications, that we do have a no wrong door approach as mandated, that if somebody comes in and applies for Medicaid in our system and they're found to be too high of income, we do refer them to the marketplace. And we will be doing that for cancellations as well. Right now, our active cases are still in our legacy system, so the connection isn't there yet, but we are working on building that and trying to create as seamless as possible of an integration with the marketplace.
So I'm going to close this out by asking everybody on the panel for one sentence, except for Bob, who can have a few minutes to close out what he wants to say. And here's the sentence I'm going to ask everybody for. Right now, we're just a few days away from elections, which will lead not only to what everybody's been watching in terms of congressional elections, but gubernatorial elections. And so there are probably going to be both new governors and governors entering a second term or a third term, I guess only second in the ones I can think of, with new teams looking for an exciting agenda item. So I wonder if everybody could write down one piece of advice that you would give either those entering governors or governors with their new teams, based on what you've learned. What piece of advice would you leave them with? And I'm thinking I might go the opposite direction, if it's okay, starting with Jen and ending with Reggie. And then I'll ask Bob to make any closing reflections that he would like to bring us out. Jen?
One sentence and 30 seconds to think of it. Continue to fight for the residents and staff of your state.
Okay, forceful sentence.
Understand who the important people are that we're trying to help and what we're trying to accomplish.
Deb?
Don't be afraid to change and make improvements. Be a good listener and grab all the support you can get.
That's great. It was a few commas and semicolons, but not too many. That was great. Sherry?
If you're interested in results and focused on results, then the path Work Support Strategies is offering is a good approach.
Reggie?
Since the next governor of Colorado will be John Hickenlooper, comma, my advice to my boss would be double down. We're on the right track, and we need to take it home.
Great, thank you. Bob, would you like to offer some closing reflections?
Well, on that particular issue, I would just say It's not broke. Don't try and fix it. It's moving in the right direction. Devote your energy to other things and let the people who are doing this succeed. Listening to the answers to all the questions, though, I come away saying, this is a work in progress. The emphasis should be on the word progress. And what encourages me the most is the amount of flexibility that we see, that people aren't sort of saying, well, here's the new model, let's hammer it down, but rather let's, ride the wave. And the inclusiveness of the decision-making, I mean, getting stakeholders, advocacy groups, channeling remarks and advice into the decision makers, I think, is very hopeful. And seeing that, many of the states are engaging the advocacy groups to help in the process, as opposed to, come in and complain about what you don't like. Say, hey, you're part of it, join us. And I think this is a very hopeful development that I hope other states are looking at and seeing what's applicable in their situations.
Like Bob, I'm just always incredibly impressed by the quality of the state leaders joining me on the panel today, and I want to ask you to join in saying thank you. The lunches are available or about to be available. I think they are available, and we invite you to stay till 12:30 and eat and chat before. After that, we move on to our next session of the conference itself. So join me in saying thank you.